You know, we all think of our homes as our safe zones, right? Our sanctuaries. But what if the very air inside them was hiding a silent and, frankly, pretty dangerous threat? As we're about to see, new science is revealing a problem that's way bigger than we ever thought.
So let me just ask you straight up, is your home making you sick? I know, it's a blunt question, but it's one we absolutely have to ask. Because for millions of people, the answer is a hard yes, even if they have no idea. And the culprit? It's something super common, something you've probably seen, but its true danger has been just completely misunderstood.
53%. Just look at that number. Let it hang in the air for a second. It's not a poll number or a market share. It's a risk. A serious life-altering risk that's directly connected to our homes. So what on earth does it represent?
Well, that 53% is the increased risk of a child developing asthma simply from living in a home with mold. And this isn't just a guess, this is from a massive 2024 meta-analysis by Varga and their team, which basically sealed the deal on the link. After viruses, mold is now considered the single strongest indoor risk factor for asthma.
And that brings us right to the heart of it. We've got to wrap our heads around the fact that mold is so much more than a gross-looking patch on the wall or a musty smell. It's a serious health threat.
And believe me, this goes way beyond just a case of the sniffles. We're talking about severe lung diseases like hypersensitivity pneumonitis, or HP. It can cause serious flare-ups for people with COPD, and there's new research even linking it to cognitive problems. And get this. Data from the CDC shows that patients diagnosed with mold exposure have 5.6 return healthcare visits in just 90 days. That's more than double the average.
And if you need to know just how severe this can get, look at this. A 2025 study from UT Southwestern on HP linked to home mold found that the median survival for patients who didn't get a lung transplant was just 97 months. That's about 8 years. This is not an inconvenience. This can be a fatal disease.
Okay, I know this all sounds incredibly grim, right? But here's where the story takes this really fascinating and honestly hopeful turn. Because it turns out this whole threat, as serious as it is, might not be as random as we think. In fact, modern science is showing us it's actually predictable.
So check this out. Researchers over at Harvard's Healthy Buildings program developed a machine learning model that can predict where mold is going to grow after a disaster, like a hurricane, with an incredible 83% accuracy. That's a total game changer, moving us from just guessing to actually knowing.
So how do they do it? Well, the AI zooms in on 5 key factors. Some of them make perfect sense, right? Like how deep the floodwater got and how old the roof is. But others are way more subtle, like how airtight the building is, the power of the bathroom fan, and even, get this, whether the window blinds are open or closed. It's a really precise science.
So, if we have the science to predict the problem, you'd think we'd be all over preventing it, right? Well, that's where we hit a wall, because our entire system for dealing with mold is fundamentally broken. It's totally stuck in the past.
And the scale of this problem is just staggering. 95% of the entire billion-dollar U.S. mold services market is reactive. We literally wait for the mold to grow, for people to get sick, for the damage to happen, and then we pay to clean it up. Only a tiny 5% is focused on prevention.
And the cost of waiting? Oh, it's enormous. An average remediation job costs thousands, and severe cases can top $30,000. But the worst part is, by then, the health damage is already done. Prevention, on the other hand, means early, low-cost intervention, and most importantly, avoiding the illness in the first place.
This broken system also creates this huge equity gap. The insane cost of cleanup, combined with terrible insurance coverage and massive delays in government aid, we're talking an average of 20 months, leaves the most vulnerable people completely exposed. Is it any surprise that CDC data shows mold-related diagnoses are twice as prevalent among Medicaid populations?
So how do we fix this mess? The answer lies in a complete shift in our thinking. We need to move away from fighting mold indoors after it's already taken over, and shift to a smarter strategy that actually starts outside the home.
This new approach is called predictive environmental intelligence. The core idea is simple, but so powerful. You use super-local, real-world data about the air outside your home, things like humidity and temperature, to accurately forecast the risk of mold inside your home before it ever even begins to grow.
It works in 3 logical steps. First, you measure outdoor conditions at a street-by-street level.
Second, you use models, like the ones pioneered at Harvard, to understand how that outdoor air is going to get into a building and affect the indoor environment. And finally, you deliver predictive alerts, warnings that allow someone to say, just run a dehumidifier for a bit and stop the mold before it ever starts. This proactive approach, its potential is just enormous, not just for creating cleaner homes, but for building a genuinely healthier and more equitable future for everybody. And the benefits just ripple across society. Insurance companies can slash their claims and price risk more accurately. Public health officials can target their help to the at-risk communities that need it most. And the real estate industry can prevent costly damage while improving tenant health. It's a win-win-win.
So, what's the big takeaway? It's this. We can completely transform the fight against mold. We can move it from being this messy, expensive, health-damaging cleanup job into a smart, data-driven, preventative health strategy. One that saves money and, more importantly, saves lives.
And it all leaves us with one final, powerful question to think about. With this technology, we're on the cusp of a whole new reality. So I'll just ask you, what if our buildings could tell us they were about to get sick, giving us the chance to heal them before any harm was done?